Oh, I came from public accounting. I worked for Mapes and Miller. It's a regional accounting firm that has offices in several of our surrounding towns, and I was there for 13 years. I graduated from Fort Hays in 1995. I was a non-traditional student, went back and got my accounting degree when my children went back to school. And I have been here for over 6 years. 6.5 years. I came on as a CFO, and now I currently serve as a CEO. I was on the hospital board when the CFO position was vacant, and I said, hey, I would like to try out for that one, and I did, and so it's been a really good journey for me. A lot to learn because I came from public accounting, but it's been good. We staffed a full-time IT person for a number of years prior to me coming, and I had a little bit of experience with Nex-Tech in my past in public accounting, and we decided that we would look into contracting our IT. We thought we could save money that way. We had lost our IT person here, and then we contracted with another couple companies, but I had, as I said, I'd had some relationship with Nex-Tech before, and so I was really, moving, that's what I wanted to do, and so we started, very limited, to begin with, but then more and more as time has gone on. At that time, we have the software for our clinic billing and our financial statements, our general ledger, and it's called CPSI, and so they provide the support for that program, but we needed someone to basically maintain our other server, which would all of our PCs and printers and those types of things. We needed somebody to troubleshoot, and we started out with as needed. The way we did that is we had a date. I guess we reserved Fridays, and there would be a Nex-Tech person on staff, and he would stay, and it's been Curtis, but he would stay if needed, 1 hour, 2 hours, and so it was pay as we needed, and it really was a good relationship from the beginning. I feel like that, the staff with Nex-Tech has really gone, that extra mile to really help us out, knowing that we didn't have anybody on staff with a whole lot of IT, experience, and that has really been great. And if one tech is not available, then somebody else can step right in. So from a financial standpoint, that's basically one of the main reasons we went with Nex-Tech to begin with.
So we worked quite a while with Graham County Hospital in the past. They'd had several different people helping them with their IT. And over the years, during that process, we had seen different purchasing mechanisms where they'd maybe try to put out certain pieces of it for bids, and then they'd end up with just a chunk of what they really wanted as a complete solution. So during this, it kind of evolved from different pieces that were broke, and then they kind of had one-off solutions for each one of those, if that makes sense.
I think the very best thing, looking back, is the availability. We always had, 24 hours. I felt like I could call, and someone would be on site if needed, or, with the way technology is, other techs, along with Curtis, have been able to, remote into our different PCs and fix the problems from there. To begin with, we had some new computers, some old computers, some with this operating system, some with that operating system. So a couple of years ago, Nex-Tech proposed an opportunity where we would lease basically the printers and the computers, monitors from you guys, and that has really helped in the maintaining, of the computers, because we're all on the same operating system. We're all, we're connected the same way, and that was their selling point is, they thought they could save us money, plus we would be using all new machines, and it really has worked out that way. And we have, we have gone from them just helping with the server part and, backing up everybody's My Documents and things like that, to A whole lot more, because now we have implemented electronic medical records at the hospital, and then just last fall we implemented the electronic medical records at the clinic, and they've just been right there the whole way through. There is software, as I said, we have other softwares, that support, but Curtis Nex-Tech has been able to work, hand in hand with them and figure out problems. So it's been a very good relationship.
Yeah, having in-house staff is really difficult with IT, because a lot of times in our communities we'll be able to hire people to run and administer IT at the time, and then they get trained up and certified in the different areas, they get really skilled, and then of course you lose them to people willing to pay more. IT is such a boom right now where keeping and hiring good staff is a continual challenge. So what we saw was, as those people kind of migrated in and out, you'd see dips and changes in IT. So maybe they'd get to a certain level with a new IT person, be running pretty good, and then that person would leave, they'd drop back off. So then they had poor performance of networks, things like that, but they get back up to different things. So it was kind of a constant up and down, maybe a heartbeat instead of a consistent level of growth, and even in getting from chaos to true performance of IT. And that's where Nex-Tech stepped in and was able to look at the whole picture and say, look, you don't want to hire people that are going to leave you, yet you want to keep your business local. You want to be able to escalate your performance to a proactive maintenance instead of a reactive kind of thing. And being in the medical industry, Graham County Hospital really understood that, good fitness can lead to good health, and so good, proactive maintenance of their network really produced a solid performing atmosphere for their IT, so they could focus on healthcare and we could focus on their needs.
Just as technology advances, we've gone from, in public accounting, I was pretty much in a paperless environment, and so we're striving to be that now, and we can just see the benefits of that over and over from the accounting, from the accounting standpoint to the billing standpoint, and now with the medical charts, it's all electronic. And IT has become more and more and more a part of our everyday operation. The other good thing about Nex-Tech is if our one person is not available, someone else can step in. So we have several multitude of techs that can help us when we are in a situation of need. When we first were setting up with CPSI, I guess we went with CPSI in 2010, so Nex-Tech wasn't involved in the early, but it's just been, when I'm out of town, I feel like I don't need to worry about who's taking care of our IT. Our director of nursing is very, instrumental in working with Curtis. We're always covered. We feel like we're always covered. We haven't had to wait long periods of time. If Curtis is not available, someone else could be here. We've done a lot with our wireless network and Sonic. We have Sonic Wall. We have different access points, so of course different Nex-Tech people have been involved in that. We also have the telephone system that you guys maintain, that Nex-Tech maintains, and so we've had a number of different Nex-Tech people here on site.
Yeah, there's a couple areas where having just one person to manage and maintain your network becomes a problem. Well, first of all, you have the issue of if that person's sick or they are on vacation, you're relying on them to be able to fix it. That's the first area. But secondly, in a hospital environment, you have everything from security to servers to medical machines to wiring and cabling to a phone system. You have all these areas of expertise, and they can't be good at all of them. Whereas Nex-Tech, because we have all of these areas with, individuals with specific skill set, you're not relying on one person. You have a quarterback of that team, but you're not relying on them. You're relying on all those skill experts to come out and work on the phone system, work on the cabling, work on the wireless, work on the security. So you're getting the best of everything instead of a minimal required performance.
They're very knowledgeable about what the HIPAA security laws and regulations are. We, as time goes on, we get more and more involved in the HIPAA security, and we have our privacy officer and we have a security officer, and Nex-Tech's always just right there. There's different forms, there's different assessments that have been made to look at the risk assessment as far as our security, and Nex-Tech has been working with us hand in hand. They have the knowledge and the background, and we've been able to, meet and exceed, our needs. Well, we have to provide that sense of security that the patient relies on us to keep all that information very, very confidential. And we do everything we can to promote that confidentiality and security, not only because it's the law, but because, for our patients themselves. We feel very confident in Nex-Tech's ability to provide that service for us.
Data security in general is a big area of emphasis now. You see all the hacking attempts, you see all of the big news hitting today with people that are getting access to critical information. So just that 101 level stuff's important, but if you look at most of the hacking attempts that are out there, they were really due to poor maintenance. They were known fixes on the market that weren't applied. There were alerts that were out there that nobody paid attention to. That's what Nex-Tech was bringing to the table here, is first of all making sure that the maintenance is continuous and those patches and the upgrades and the security alerts were paid attention to. Secondly, we were looking for these security alerts, so if bad stuff was going on, then we could pay attention to them immediately. So if somebody was trying to get into a network, we would shut down those particular ports or shut down that attack. So it's people paying attention to the details that only a team of people can do on a 24/7 basis. Whereas if you were relying on tools or relying on a single individual, at some point in time, it's going to fail. HIPAA and regulatory compliance is a huge part of what we have to provide now. And it's as simple as providing the paperwork and the documentation to do asset disposal, and that's a fancy word for making sure a computer is disposed of properly and the data is disposed of properly when we remove it from the network, all the way to the complexities of just making sure that the people that we're sending into the network are held under responsibility, that the data does not leave the network, and if they see proprietary information, it is locked to just that individual and they won't spread it, to the protection of the data of backups, the encryption levels. If it's a laptop and it leaves the network, it's encrypted, so if it gets left on an airplane or something like that, there's no worries or threats to the patients or the hospital. So it becomes a complete cycle and a complete flywheel of security, and it's always evolving, it's always updated. And I, be honest with you, I have no idea what the next threat's going to be. I just know that we're going to have to change the way we do business on a continual basis to protect the responsibilities of that medical clinic.